I know that Louisiana ranks very low or I should say very high on maternal deaths amongst the states. So what do you think needs to be done there to improve that, especially if forms of abortion or birth control could be limited in the future?
Senator Bill Cassidy from Louisiana is about to make a fool out of himself by saying something pretty terrible about Black women who literally die during childbirth. But just know that more women die from childbirth in his state, in Louisiana, than anywhere else.
About a third of our population is African American. African Americans have a higher incidence of maternal mortality. So if you correct our population for race, we're not as much of an outlier as it would otherwise appear. Now, I say that not to minimize the issue, but to focus the issue as to where it would be. For whatever reason, people of color have a higher incidence of maternal mortality.
In other words, let me literally minimize maternal mortality among Black women, make it so they don't even count in the statistics, and only focus on white women who die during childbirth. And if you just take Black women out of the equation, not so bad, not so bad. And by the way, he makes the statement even worse later, Cenk, by saying, well, you know, I mean, mortality is higher among Black women for whatever reason. Gee, what could the reason be, Cenk?
Yeah, and of course it's because they don't get enough funding and institutional racism. So, but I don't want you just to say those words and have people who don't understand the background and the history go, oh, blah, 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 they said racism, I'm running away. First of all, one of the things that happened is that accumulation of wealth happened in white families, but not in minority families. We've had many discussions about that, redlining, Jim Crow, etc. And what that created was people who are in a lower socioeconomic position in mass, and then that creates healthcare issues that then are harder to overcome. If you're wealthy in America, it's much easier to get maternal care. If you're middle class, it's okay, not bad, but in some areas and not so great in other areas. If you're poor, God help you, white or Black. And then on top of that, you have other institutional racism that we've talked about in the past in the healthcare system. How do doctors, especially in places like Louisiana, perceive a white patient versus a Black patient? I mean, you see it in their senator here. He's basically saying in the first part of that sentence, I mean, look, if you just look at the people we care about, white people, we're doing okay. But if you look at the Black people we don't care about, they're not doing that well. But that's okay, because who cares about them? Well, how do you think they got to in the position that they are on maternal health care? It's with attitudes just like that.
A few years ago, the New York Times wrote a pretty excellent piece talking about the high rates of maternal mortality among Black women in the United States and all the various drivers that play a role. So you're right, socioeconomic status is a huge driver because if you're poor, you are less likely to have the resources and the access you need to have a healthy pregnancy, to get the maternity care you need to carry out a healthy pregnancy. The other issue, by the way, that was noted in the New York Times piece that I thought was telling is the way that even wealthy Black women are treated in our healthcare system. For instance, there are studies that point to the fact that doctors are far less willing to believe a Black woman when she says that she's experiencing some complications or she's experiencing more pain. The other thing that's worth noting is that the maternal mortality rate in the United States has been going up year after year. Republicans have not cared about it at all. It's actually much higher in the red states that will outright ban abortion. And if you do away with abortion, women who don't want to carry that abortion to term are far less likely to get the maternal care that they need and are at a higher risk of dying as a result of their pregnancy or during childbirth. So that's all important context to know. But let's also hunker down and take a look at what's happening in both Louisiana and the United States in general. Let me also note though, that conservatives love to point to, well, abortion is really Black genocide. They refer to it as Black genocide because they claim it's because all these Black women are having these abortions and all of these Black babies that they purport to care so much about don't end up getting born. But You just heard what Bill Cassidy said in that statement. He doesn't care about black people, certainly doesn't care about black women who are dying during childbirth. He wants to erase them out of the equation altogether. Now let's look at some numbers. So according to a USA Today investigation based on birth rates in 2016 and death rates from 2012 to 2016, Louisiana had the highest maternal death rate with 58.1 deaths per 100,000 births. And just so you can have something to compare that to, according to the CDC, the average nationwide in 2017 was 17.3 deaths per 100,000 births. So Louisiana certainly stands out. Again, has the highest rate of maternal deaths during childbirth. But let's take a look at more recent numbers, okay? Because if you thought that was bad, it's about to get worse. The US maternal mortality rate in 2020 was 23.8 deaths per 100,000 live births, the highest it had been since before Roe was overturned, according to the Commonwealth Fund. The rate was actually far higher among black people, which is not a surprise, 55.3 deaths, which is nearly 3 times the rate for white people. And by the way, this has been an ongoing trend. The US maternal mortality rate more than doubled between 1987 and 2017, according to the CDC. By contrast, maternal mortality in high-income countries decreased slightly every year on average over roughly the same period, according to a 2016 study.
Okay, so there's 2 different issues here. So his racism is clear. I mean, anybody can see it. I think even white right-wingers are like, yeah, I mean, if we exclude blacks, then we're doing okay. Thereby implying, without any shadow of a doubt, that you don't care about black people. You think as long as white people are doing well, who cares about the blacks in Louisiana? So let's be super clear about that. And then, look, if you are surprised by these numbers, it's okay, I get why. Like, so if you're, let's say upper middle class, and you might be thinking, how do we have the highest maternal fatality rate in the developed world? We're the lowest? How could that be? I don't know anyone who just died in pregnancy in America. That's right, you don't, because you're relatively well off. But poor people are dying all the time and you never see it. Now, is it all the time fair? Yes, we rank the lowest out of all developed nations. Isn't that unbelievable? We're the richest, but we rank the lowest. Why? Because we don't care about poor people in this country. So that leads us to the largest issue. Yes, the racism is horrific and apparent, right? But we don't have universal health care in this country.
No, we don't.
So all the other developed nations are doing okay on these maternal issues. Why? Because they have universal health care. And they pay half as much. We pay twice as much. Almost all of the extra billions goes right into the pockets of executives and shareholders of private health insurance companies whose only purpose is to rob us blind. That is their only purpose. Every other country does not have private health insurance like we do, and they don't need it. It costs half as much and way better results. And so if you're rich, you're okay in this country, but God help you if you're poor or middle class, because we will let you die so that some executive can make more money. That's a fact.
But no, it's even worse than that. And I want you guys to be clear on this. This is not a mistake. This is not an accident. This is very much intentional. Let's take a look at the state of Mississippi. Mississippi, where abortion will immediately become illegal when Roe v. Wade is overturned, has the highest rate of child poverty in the country and recently rejected a bid to extend postpartum Medicaid coverage. It is by design, and these are the people who will lie to you to your face and pretend like they're pro-life. But let's not get it twisted. What this is really about is the fact that they need something to campaign on. And the reason why all you see from the right wing over and over again is culture war stuff that actually does end up hurting people is because that's all they've got to campaign on. They don't care about the collateral damage. They don't care about lives in the context of their anti-choice rhetoric. It's just something they need in their platform to run on. And you should pay attention to their actions, not their words. Their actions make it clear they don't care about you, they don't care about your kids, they certainly don't care about human lives, they care about power. And they've used this issue to the detriment of women across the country to accumulate political power and nothing more. That is the reality.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.